Hey guys, I'm doing this video. This is what I'm doing during my gap year and what I'm going to be doing up until I start medical school. So first and main thing I'm doing is scribing at a family medicine clinic. I do this about 2 to 4 times a week. I'm not working full time. I'm not really doing full hours, probably 20 to 28 hours a week currently. And that's about the range I want to stick at for now. I might amp it up a little bit in the springtime once I'm done with med school interviews, but right now I don't want to schedule myself for too many hours because then, all of a sudden I get called for a med school interview in 2 weeks and it's like, be here or what, or else. What are you going to say no to a med school interview? Like, what do you have more important than that going on? So yeah, I'm working 20 to 28 hours a week. I'm also on call if anybody misses or a doctor needs me. So that's what I'm currently on right now. And yeah, I'm a scribe. So really what I do is record the subjective information between a doctor and a patient. So anything that a patient comes in and says to the doctor, if that's relevant to their medical history or the chart, then I'm writing that down or typing it down. And that's subjective information that the patient's giving the doctor. Then when the doctor does the physical exam, so say they go hands-on, check their heart, lungs, neck, everything like that. If the doctor, the physician themselves tells me something, that is objective information or physical exam information, so that goes in a separate part of the chart. Other duties I have as a scribe, one's putting medications in. You have to know the differences between brand names and generic names, so that's always pretty tricky, and you have to just know those minute differences because the doctor might say something really quickly and then move on, but you have to know those differences there. Another thing is putting common labs in, Dopplers, ultrasounds, CT scans, x-rays, the different views on the labs, so that's always interesting too. And finally, after you're done with all that, after you put all that information in, you get to go over the treatment plan with the doctor that you put into the chart. And that's really when you get to pick the doctor's brain and ask them, how did you come to this conclusion? Or they might just offer the advice out of nowhere and tell you what they were thinking when they saw a certain thing. And that's always really fun. I think that's probably the most rewarding part of my job to me personally, is seeing how the doctor approaches a different situation and seeing how each doctor has a different style and just how they go about treating patients, because they all do have a different style. So yeah, that's what I guess I enjoy the most about my job. So the second thing I'm doing is volunteering at the local children's hospital. That's called Driscoll Children's Hospital. It's in Corpus Christi, Texas, here where I live. And it's been a pretty rewarding experience thus far. I had my qualms and, disagreements with the hospital. It was just, there's so much background checks and orientations and all this stuff. It took me about 2 months total before I even started volunteering. So I was kind of a little bit, annoyed at that part of it. But now I'm actually volunteering and liking it. So what I do currently is I'm a helper to a person who brings therapy dogs to patients and their families. So we go around different rooms in the hospitals, different floors. Each floor has different, different types of diseases and pathologies. Like there's an ortho floor, there's like a neuro floor, there's infectious disease floor. So you go to these different floors, and each floor, you bring the therapy dog in, obviously make sure everybody's sanitary, and put a sheet over the patient, ask if they have any injuries, recent surgeries, so the dog doesn't hop up on them. And yeah, it's really good. You get to see the patient, cheer up, and you see their family cheer up, even though they're in the hospital. For kids in the hospital, it's never a good time when a kid's in the hospital, but they kind of forget about that for a few minutes, so that's always pretty nice to see that happen. So yeah, that's what I'm currently doing. I do that once or twice a week at the children's hospital, and I'm liking doing that a lot. Third thing I'm doing is a lot of my hobbies here back at home. So I like to kite surf a lot and I like to fish a lot. So kite surfing is something that I recently got into in college. One of my friends used to do it here, and now he got me into it, but he doesn't really do it anymore. But that's besides the point. I'm really into it now because I'm back living here at home with my parents. So I can kite pretty much anytime I want, anytime there's wind, which there's a lot of wind in Corpus Christi. So yeah, it's super fun. I'm just trying to progress in the sport. I'm already to the point where I'm doing jumps and tricks and all that. So I'm just trying to get, better at my tricks, better at my jumps, more proficient in riding, and yeah, just improving in the sport and enjoying it. Just having a lot of fun each time I'm out there. Just got all new equipment and everything, so I'm really hyped and just psyched to do that for the rest of the year. Another thing I'm doing currently is fishing a lot. So I like saltwater fishing, mainly with artificial lures, and the fishing is pretty good around here in Corpus Christi. I've done it, for 10 or 15 years, so now I get to do it a little bit more seriously because I'm actually home, which is a good thing. And yeah, just enjoying that, enjoying doing it with my friends, kiting with my friends too. That's always fun. So, really taking up these hobbies pretty hard right now because I'm not going to have the free time that I have right now in medical school. So I got to get all these hobbies and everything and really enjoy that time because I just know there's not going to be time like that in the future. So it's just great to be able to be home, be kind of, not financially burdened, and being able to do that right now is just a really, fun thing. Like I said, I am living at home, so there is some benefits to it. I don't really have to worry about finances all too much. My parents are letting me live here for free, so that's a good thing. I don't have to worry about groceries. I don't have to worry too much about meals or anything like that. That's all paid for. So if I was living out on my own, I'd have to worry about that like I did in university. So that's always nice. But then there's obviously the downsides at it. You have less freedom. You're living back at home with your parents. And just all the qualms that come with that, and conflicts you get into. But I think at the end of the day, it's probably worth it. You get to be around your family and parents constantly, and you in the end of the day, you still know it's only temporary until you start medical school. So yeah, that's pretty much all I'm doing currently until I start medical school. And I was recently accepted at Auburn. So I have 2 med school acceptances currently, and I have another 2 upcoming interviews. So I'm still undecided where I'm going to go. I really don't know yet, but wherever that ends up being, I think I'll probably start end of July or early August of next year. So I'm looking forward to that. And this is just all I'm doing currently up until I go to med school. I'm trying to, keep learning and reading different studies and, reading research and stuff like that. Also reading in EKG book one of the doctors gave me. So just trying to keep in that cycle of learning even though I'm out of school currently, because I know that transition back to school is going to be a little bit difficult, being out of school for a year now, or will have been out of school for a year now. So yeah, that's what I'm doing on my gap year. And let me know if you're taking a gap year in the comments, if you've taken a gap year, what you did in the gap year. Yeah, just subscribe and follow me on Instagram, and hope you enjoyed this video. Thanks.